Okay, so we're back on the third installment, the last section of our lesson, last video for our lesson in the Affordable Care Act. And again, I just want to mention um, that our reference for this material is the Kaiser Family Foundation. Okay, so let's talk about the goals of healthcare reform in terms of reforming the quality of care. So let's look at the health reform and delivery system changes. In addition to the provisions focusing on health coverage, the law makes important changes to the healthcare delivery system. This delivery system changes are aimed at improving access to care and overall quality and to rein in the rising healthcare costs. So it's a relationship between quality of care and uh, trying to control the rising cost of healthcare. So they do cover a number of areas, including promoting primary care and prevention, improving the supply of providers, having enough providers where they are supposed to be at, where they're mostly needed, particularly primary care providers. And then also creating new models for delivering healthcare to promote quality and efficiency by using health information technology, to streamline the delivery of care, and also to create incentives for quality care through provider payments. The health reform law also places a strong emphasis on primary and preventive care. So to improve access to primary care, the law increases Medicare and Medicaid patients for primary care providers. Also, through loan repayment programs, scholarships, and other mechanisms, the law creates incentives for new doctors and nurses to practice in primary care. In addition, the law seeks to increase access to preventive services by requiring Medicare and new private health plans to provide coverage for certain preventive services. I did mention this before, including mammograms, colonoscopies, diabetes screenings, at no cost to the consumer. So it provides incentives in the form of enhanced federal payments for states to offer the same coverage through Medicaid programs. To improve the health of the population, the law creates the Prevention and Public Health Fund to support initiatives to prevent obesity and diseases such as HIV, promote tobacco cessation, and strengthen the public health infrastructure. Now, how is this done? This is done through grants provided by the state. And there are requests for proposals for this. As one of the overarching goals for health reform, the law contains numerous provisions to improve healthcare quality. And while it's not possible to describe all of the quality improvement provisions, here are a few of the more significant ones. First, the law requires the development of a national quality strategy to coordinate federal activities to improve the nation's health. It promotes more coordinated health care through the creation of patient-centered medical homes and other arrangements that hold providers accountable for the care they provide. Paying providers based on the quality of care they provide and making information on provider quality available to consumers is a central provision of the law, a central tenet of the law. And it also invests in research to identify and disseminate findings on the most effective treatments. Finally, enhanced data collection will enable a renewed focus on reducing healthcare disparities, which we have learned in Chapter 2. We had an extensive discussion on healthcare disparities, health inequities, health inequalities. Another key area addressed by the health reform law is containment of health reform costs. Some of the provisions in the health reform law targeting healthcare costs focus on healthcare prices, primarily the premiums insurers charge, while other provisions address provider payment methodologies and the ways in which the healthcare system is organized that may be contributing to overutilization and inefficient delivery of care. Regarding prices, the law requires states to review premium rate requests by insurers to identify excessive or unreasonable premium increases. Insurers will be required starting in 2011 to spend a certain portion of premium dollars on patient care, as opposed to administrative costs or profits. The offering of standardized plans through the exchange will make it easier for people to comparison shop, which will spur competition and possibly lower premiums. So whatever extra money health insurance companies make, they are supposed to reinvest it back um, in healthcare coverage. In other areas, the law calls for reforming payment policies in Medicare, including reducing payments to Medicare managed care plans, known as Medicare Advantage plans or Part C Medicare. This is the one where we have managed care and health insurance companies set up their own Medicare plans. So how does the law do this? They do it by slowing annual payment increases for other providers, as well as reducing payments to providers for avoidable complications. We're talking about hospital-acquired infections and also readmission. So it's sort of a penalty. It will also test new delivery system models that will be designed to provide higher quality of care that provides healthcare services in a more efficient manner. So the challenge of transforming our healthcare system, which represents about a sixth of our economy, is definitely daunting and not easy. It will require guidance from the federal government to explain how the law will be implemented, as well as to provide oversight to ensure that implementation is proceeding as expected. Key stakeholders, including states, health plans, employers, and providers, must commit to making the necessary changes. There are some things that have actually unraveled through the years. Obviously, not all of the states have been cooperative in some of the changes, and there were some challenges to the law which were brought to court. Now, resources to build infrastructure and to expand provider capacity will definitely be needed, and all of these will be done in the face of stiff political opposition, which we have seen in the last 10 years since the law has been put in place. So despite all the challenges, we can get it right. Well, we hope so. And right now, we know that Obamacare is not perfect, but I hope that whatever we have talked about sort of clears up some of the questions you may have about how healthcare reform was structured and how it's supposed to be helping us. So where are we right now? Where are we and what's the progress we have made on healthcare reform? So first, let's look at where the states stand on health insurance exchanges. Let's see with which states actually operate their own health insurance exchange. So there are two ways. They could either use the one that is operated by the federal government, or each state can operate their own health insurance exchange. So let's first see and visit this website. So if you're interested, this is the website. Click on this link. And this is a list of which states operate their own marketplaces to purchase health insurance and those that rely on the federal marketplace. So we'll visit both New York's, because New York has its own marketplace where you can buy your own health insurance, whereas North Carolina, for instance, doesn't have. So what happens is that their citizens, if they want to buy health care insurance, what they need to do is practically visit, there will be a link, and they visit the federal marketplace. Go back to the PowerPoint. I have shown this earlier. This basically, again, if you want to visit the website, this is Kaiser Foundation. This is a list of states that have not expanded their Medicaid program and those that have adopted. You could look at the map, which I have actually presented earlier on. It hasn't changed since March. 37 states, including District of Columbia, have adopted the expansion of Medicaid. So I encourage you to visit the website just to find out which states have expanded or not. Now let's talk about the subsidy calculator. Remember that if you choose to buy your own health insurance, meaning you don't qualify for Medicaid and you don't get health insurance from your employer, you could actually choose to buy your own health coverage through the health insurance exchange, either an exchange that's operated by your own state, or if you live in a state that doesn't have its own marketplace, you'll have to go to the federal marketplace. But let's visit this website because this shows us how much one particular person can actually save, or how much subsidy one particular person can actually receive. So it's a calculator. So let's choose New York. Let's enter a zip code. Let's say South Bronx, 10459. Yeah, let's choose income as of 2019, the one that you filed. And let's enter, let's say you made $30,000 for that year. Is coverage available from you or your spouse? Of course, it's no. And number of people in the family. Say you're just by yourself, okay? You're alone. Number of people in the family is 1. And which members of your family are enrolling in marketplace coverage? Individual, because there's just you. Let's submit. Okay, here's the result. You are eligible for financial help. So based on the information you provided, it says here that your income is equal to 240% of the poverty level. Remember, you could get as much as up to 400%. So the estimated financial help you'll get from the government is $423. The real cost of the coverage is $622 per month. But because you are going to get help from the federal government, you only pay $200, $199 a month. That's for a silver plan. You could opt for a bronze plan, and it's right here. It will tell you if you want a bronze plan, which is a lower tier than the silver coverage. So as you can tell, if you're making $30,000 in New York and you have to pay rent, an extra $200 may be out of reach to some individuals. So let's just say, how about I live in, say, South Harlem, 026. Let's just say I own my own business. I am a personal trainer, and I made $80,000. And same, individual, submit. And it says you are not going to be eligible for financial help. Your silver plan is $622. This is what you're going to have to pay out of your own pocket to pay for your monthly premium. Now, that's a lot of money, $622, if you're making $80,000 a year. Now, let's see if there's 2 of you and you're a couple. and you filed jointly, and you both your income, you make 90,000 between the two of you. And let's say, yeah, you live in South Harlem. Let's see. It says you are not going to be eligible for help. And your premium for the two of you is going to be $1,244. I would imagine that's out of reach. Let's say there's two of you and you made 60,000. Or let's just say you made 50,000. And there's three of you. That's two parents and one child. Let's see how much you'll get. Wow. Your cost for all three of you guys would be $322 because the government is going to help you with $1,450 a month on top of the $322 because your total cost is $1,772 per month. So I encourage you to play around with this website. Again, this is the website. You can just Google this, Health Insurance Marketplace Calculator, Kaiser Family Foundation, and this should give you an idea what kind of coverage, what kind of government subsidy you might receive. So let's visit this website. This is the New York State Marketplace website. So this is how you get started. You just click on here. You have to create your own profile, and they'll ask for all this information. Now this is the same for states, for people that live in states that operate their own marketplace. And we do live in New York, so we do have our own. Remember, you can, if you are actually qualified for Medicaid during the process here, it will tell you based on your income. All right, let's go back to the PowerPoint again. Let's visit the federal marketplace, which is operated by the federal government. This is how it looks like. It's healthcare.gov. They actually extended the open enrollment. In the state of New York, they have extended it because of the COVID-19 pandemic. Anyway, this is the website where people who live in states that wish to buy health insurance, but they live in states that do not operate their own health insurance marketplace. Okay, so again, I encourage you to explore these websites. This is the website. And that's the end of our lecture for the Affordable Care Act.